Okay, so 3 very simple tests for the abdominals. There's many ways to test these. These are the ones that I like. They're simple, easy to use, and then when you needle, you see a pretty amazing change. So, the first test is for the rectus abdominis, the second test is for the transversus abdominis, and the third test is for internal and external obliques. So, first thing I'm going to do is I'm going to have him bring his legs here and rest his feet on the table. Second, I'm going to lift the legs up. I'm going to carry all the weight. And then I'm going to have his hands by his side, breath in and out. Don't let me push it down. Okay, and relax. I always have him relax in between tests because I don't want to get a false reading. And it can be hard or tiresome, or if it causes pain, if it causes pain just to get into the position, then I don't apply pressure. So, second test, that first one was rectus abdominis. You bring the legs up, 90 degrees of hip flexion, 90 degrees of knee flexion. Then you cheat the hips back about 10 degrees away from the nose. Then you have them hold their legs up, breath in and out, don't let me push it down. Good, and relax. That again was rectus abdominis. The next test, everything is the same for the transversus abdominis except for one thing. You're going to have them pull their belly button in towards their spine 1 inch. So sometimes I give them a cue. Pull your belly button in towards your spine. Now. So I'm going to get him back into the position, lifting the knees up. 90-90, cheat back about 10 degrees. Belly button pulled into the spine, breath in and out. Don't let me push it down. And relax. Excellent. Third test. Just going to have him extend his legs out if that doesn't hurt his back. Going to have you bring your hands together in a prayer position, then straighten your elbows straight up. Breath in and out, don't let me push. Breath in and out, don't let me pull. Okay. And relax. Good. Okay, so just to talk about the locations of these abdominal points, it's a pretty simple, straightforward protocol. You can use other points. The region of the points that I'm using are a region of the motor points. So there are more motor points than the ones I'm using, but this is just kind of straightforward. If you just wanted to have a protocol that you could do over and over and see how that worked out for you, you could try this one out. If you already have something that's working for you, use whatever it is that you use. But the points that I use are stomach 21, 23, and 27, liver 13, and gallbladder 26. Now, stomach 21, if you recall, is 4 chun above the umbilicus and 2 chun lateral. Stomach 23 is 2 chun above the umbilicus and 2 chun lateral. Stomach 27, 2 chun below and 2 chun lateral. Liver 13 at the free end of the 11th rib, and gallbladder 26 just below that, but level with the umbilicus. Additional points, if you wanted to think about it, could be a posterior gallbladder 26 that is underneath gallbladder 25 with the addition of gallbladder 25, so that you are at the free end of the 12th rib and also behind a made-up point. That's the posterior gallbladder 26. Another option is if you find the crest of the ilium and just go 1 chun above. Another option for the transversus. Also, if someone has a scar from a cesarean section, that might be inhibiting these muscles because the fascia comes together in this area, and with that horizontal scar, they really can destabilize the whole area. And so you might need to needle in and around the scar to actually get a change. So if you do this protocol, generally you're golden, you're going to see a change in those orthopedic tests that I showed you at the beginning. However, if you don't, places to look are those posterior liver and gallbladder points, 1 chun above the iliacus and down around the scar if there's a cesarean. Okay. Needling is very simple. I'm sure there are many abdominal points and many areas of excitability in these muscles. This is just a simple protocol that I use. I find it very effective. So the points that I'm using, if you look here, 4 chun above the umbilicus and 2 chun lateral, is the region of stomach 21. There's a motor point just above, but I find this works for me. The region then 2 chun above the umbilicus and 2 chun lateral, stomach 23. Again, there's a motor point right adjacent in this area, and I just find this point works. And then the last point for me is 2 chun below the umbilicus, 2 chun lateral, stomach 27. These are for segments of the rectus abdominis. Occasionally there may be an upper segment or a lower segment that I might add, but this is just usually money in the bank. So again, stomach 21, 4 chun above the umbilicus, 2 chun lateral, stomach 23, 2 chun above the umbilicus, 2 chun lateral, and then stomach 27, 2 chun below, 2 chun lateral. The next points that I use 4 points, and I do them symmetrically. And so I do liver 13, which is for the external abdominal oblique, and at the free end of the 11th rib, liver 13. So, and then I come down, level just from there, level with the umbilicus, and do gallbladder 26 for the internal abdominal oblique. And also at the depth that I'm doing it, I'm hoping to have an impact on the transversus, and I seem to have an impact on the transversus because the test changes when we retest after. So the needling is pretty straightforward. I'm going to use red sarin so you can see. I like to angle oblique inferior towards the renmi. These little red sarins you can see, sometimes I'll use DBCs 18 by 30 and a kind of oblique inferior angle towards the renmi. I like to feel it, some changes in the tissue depth. And these points should never hurt. They usually feel like pretty much nothing going in. And for the patient that has this being a component of their back pain, you know, maybe the back pain is a result of instability here in the abdominals, then they're going to immediately notice a difference. They won't have the back pain with the test. All right, and one more. That's the needling, and it's very simple. And so this just works pretty well. It's straightforward. I put everything in and I take it right out. I don't leave it, I don't e-stim it. You can do all those things, that's just not what I tend to do. Muscles. There are many ways to test the abdominal muscles. I like these because they're pretty straightforward and easy to do, especially if you're in a hurry. So the first test is for the rectus abdominis that goes straight up and down the fibers. The second test is going to be for the transversus abdominis, that is the wraparound fibers that are horizontal, might be in Chinese medicine terms, maybe equate with the daimai. And then the third test is going to be for the external obliques and the opposite internal obliques. So external and opposite internal. So that's where we're kind of getting these cross-body patterns with the last one. Okay, so first test, rectus abdominis. You're going to bring the knees up and feet flat. If that causes any pain, we might be done here. But assuming it doesn't, we're going to bring the knees up, hips into 90 degrees of flexion, knees into 90 degrees of flexion. Bring your knees down just so your feet down. Perfect. Then you're going to cheat the hips back about 10 degrees to try and take the hip flexors out so that you can really get a good test of the abdominals. Now, hands by your side, breath in and out. Don't let me push you down. And relax. I always say and relax in between the tests, and I have them put their feet down and I kind of shake things out a little bit just to let everything really relax, because it can be a lot of work. If this test is weak, in this person it's strong, we've already needled them, but if it's weak, you're going to feel the feet go down, or maybe they might not even be able to hold their legs up against gravity. It might cause pain in the low back, pain in the SI joint. You might see the neck really like tense up and try to get involved. You could see the whole upper body come up off the bed. But in a strong test, which is what you just saw, you're going to apply some pressure, you're going to feel the muscles engage, and you're not going to see a lot of movement otherwise in the body. The second test, transversus abdominis. That's the wraparound diami muscle. So I'm going to put the knees into the same position that we just did for rectus abdominis, and then I'm going to ask him to do one more thing, which is to pull his belly button 1 inch towards his spine. So I'm going to bring his legs up, I'm going to do all the work, 90-90, then I cheat back 10 degrees. From here, pull your belly button into your spine 1 inch. I like to touch it to give him a cue as to where the motion should happen. Then breath in and out, don't let me push you down, and relax. A lot of times, this test, even if the rectus abdominis was kind of strong when you did it, even though with this very subtle change, you'll be surprised to see how many people fail this test. Even Pilates instructors and people who are very much body aware and aware of transversus might fail this test. Okay. Third test, I'm going to bring the legs straight out, and I'm going to ask you to put your hands together for our position, and then straighten your elbows right up to the ceiling. And I'm going to have you breath in and out, don't let me push, and breath in and out, don't let me pull. Okay, so I'm not using a ton of pressure, I'm not trying to overpower him, I'm just trying to see, can he neurologically engage and can I really feel that muscle lock on. If this test is weak, when I pull, you're going to see the whole body roll, and when I push, you're going to see the whole body roll. So again, in this person, we've already needled, so they are not weak. All right.